If I gave you the pressure, she was like, then the frustration.
Well, turn the lights on.
Waiting on these documents.
I didn't know you could do that picture-in-picture thing.
Yeah, they figured this out long before I got there.
Okay, so you are.
Oh, baby.
Uh-oh. Just,
You haven't liked it.
I got a puzzle for that.
What's that?
You want to invert the camera left to right?
Yeah, we do have it. How, we have a camera upside down. You know what? I don't.
It may not matter for tonight, but take a note.
Well, the problem is that the slides read backwards.
Yes.
Well, in the picture they do.
Well, no. In the picture they do, but not out here. They're fine.
Okay.
So the camera needs to be inverted. But I don't know how you do that.
Yeah, I don't know how you do that either. I'm gonna have to ask Casey about that. That's a new one to me.
We're learning.
Maybe.
Start a notepad of all the things we don't know that we need to know.
Well, I've got that little software running that controls the camera. I would look at that, but it looks like everything is working right now.
Good
I'm not
enough.
gonna mess with it.
No, that's a fair.
It looks like we're set up and ready to go for our speaker, so.
So maybe in the next technology meeting, we should open up the technology card and say, okay, we're missing a lot of details.
This is the technology card, and it talks about the room setup. So one thing it doesn't do is talk about what you do when you're in the software. And that's the piece of the help.
We just need to add it.
Yeah. We'll start taking some notes and we'll
This
just,
was half of my career is,
Build this
why don't
card
we
out.
just write this down?
that's what we do in Trello, is we document everything there. So that's the next step is, once I learn this process a little bit better, is I'll
Yeah.
start documenting it.
Yeah, no, I was
Because I
always,
definitely want to teach it to you so that we've got more than one person who knows how to do this. You can change the equations.
that's okay, I just pointed out again.
I told him, I said, look, your kids are more important than I am.
No, it's perfect because it showed us a gap in our procedure.
Well,
So
and
that's
what
great.
it did is I spent 2 hours on this last night. It forced me to get into work.
Well, but we should have had it documented.
Yep.
See, when my company formed IT architecture, which we never had one before, on the shared drive, I just made a folder called How To. And every time I learned how to do something, I put a document. And just like what you're doing. And I just kept adding detail. And as people tripped over stuff, anytime I answered a question, I put it in the How To.
You know what's interesting? The lettering is not reading backwards. Leadership and team dynamics and clinical.
No. It's this image that's back.
Oh, it's the
Your
image.
normal image is right until you try and look at the camera, and then it's backwards.
Yeah. It'd be interesting to see who notices that. Put something into the survey about it.
Yeah, no, probably just start taking notes on that one and just say, hey, we need to figure out how to invert the camera.
Take a look.
No,
Real quick.
don't mess with success.
It's gonna bug me. That is so freaking weird.
Yes. Assuming you're a project manager there, that's manifest.
Figured out. I think that's fine. Thanks for bringing it up. I'll ask Casey about it. See if he can-
Hybrid one.
So we contract.
It's Wednesday, so I work. No, I had the phone interview. I didn't. Asked me. Yeah. Yeah, they asked me. They reached out to me. How are you doing today, Doug? Not too bad. Super hard to know. Yeah. Yeah, I've been. No. Yeah, I was like, I got my. So, been in chapter since then. Never been in that. Now you have a, I don't have my 4-year degree, so I'm going to wait till 5 years mark. Yeah, that's very special for that or whatever. Yeah, I took and they were trying to get you to that's right away. And I was the first time pass. Oh, I think so.
Like a set to celebrate maybe
Like anything you do that like keeps you on the path. So the other thing,
John, we don't, I don't see it.
I
just see her presentation.
And so,
Reports, public your presentations. All I see is
and then I have my black belt.
So I don't see
The
the
first few questions on the test are amazing. Taking one of those classes. Yeah.
Maybe I probably what I have to do in order to get into this, take the slides now.
It's online.
There they are.
Yeah,
But what did you
I don't know why you did
There's her deck. Yeah. There's the welcome music. Yes.
And IUPUI is pretty good to just that.
Yeah.
Well, too, they're splitting up from or even if you had to do something.
Yeah, that's gotta be fun.
Went to, or quite a bit, when I was going through the course, they didn't really know what that was like. I would say it was more than.
I heard you're out there.
Have any idea where on the Google Drive the welcome slide would be? It was never uploaded.
Right. So we don't have what is a hyper.
Huh?
Doesn't matter, we don't have it. What can we do to fix it? Can you get there from this computer? Or is anybody else online?
Let's find out. I mean, they were really trying to learn
They wanted to know from everybody who took the test what they thought in terms of how much happened.
That was the, like, the 2021, that was right when they switched. So I got no issue with it. So you were like,
And I went over and I took it somewhere.
Oh,
so
wow.
it was insane.
You want
I think
to
by
be
now,
going
well,
to.
yeah,
Right.
Yeah.
what was it? Oh,
Yeah. It should have.
Oh.
Go to the fellow board. It's for that.
It's in there?
Yeah, PM training. You can take them out of the tests.
I.
That's really, but of course, the new course.
Which technology part is?
It's all- it's all-
Both on
You have extra classes. Sure, so it's a good part of this. But they also have classes. And then they have to prep course, which is probably worth it. It's not very much. I think it was like right. Yeah, it's structured in math. I remember it was 15 courses, like days.
Yes.
Hey, John.
Yeah.
Which part is the?
Share.
Program. It's card program.
Oh,
Yeah, program.
Friday.
Rich, I'm into Google.
Oh, you do that?
No. Folder, I remember where's the folder?
It could be a 3. That puts you back in salary.
I got it.
Definitely don't talk as much as we did when we worked.
It just, I mean, it's research, right?
It was a project.
Really need to have that.
Hey, John.
Yep.
Can you need your music?
Yeah.
No music till we get those slides.
Gotcha. Okay, so what are we?
And the other thing that's good about it is it covers the 35 hours.
I just said I don't have access to
It is. Right.
I wish something like this existed, but I don't.
Right. Right.
So it's nice to get somebody to say, this is real.
Yeah, no, I think it's worth it.
Are you, you guys find the slides?
I can't find it.
What do you mean you can't find it?
I'm looking in the wrong place.
I look for.
My paper's in the wrong place.
Where are you on the whole?
I'm on the Google Drive.
Regulation comes over.
So, there's like that.
Just want to see times.
Yep, it's wrong.
He does beautiful work.
That's what
Come over to my.
When you get a chance, registration is in 14.
January
Okay.
10th is Monday.
As in the computer or as in the paper?
But the person doesn't have an account, they don't have to create an account. And it says enter your email. Are
Okay,
you
just,
doing that?
just use the paper
Okay.
to log them in. And I will.
Oh, that's, I'm sorry. I forgot.
Right. You make medical beds.
Yes. That I guess.
I think I got it. Oh, Rich is on it.
3 years.
That's quick. Bring it into the presentation.
I have options. It's kind of nice. I work in their US. It's actually 2 centers. That's like one of 10 minutes. So, it's pretty, whatever, it's kind of whatever I need to do each day. If I got busy work, I'll stay at home. If I can go in, I'll go in.
Yes, Kelly?
I haven't really been a part of the project management group, but it's very, kind of regimented. Where my history
Now you got it. You email it? No, John, it's a quick meeting.
A 10-click meeting? Okay. Bring it up.
But it's actually 6 Sigma that did project management.
Yes, sir. I got it. I got it.
So I'm looking to get into more of the
Any other?
I've been doing a lot of robotics and for warehouse.
Okay.
Yeah, I'm
Yes.
Kind of where,
process control.
I deal with them more aerospace manufacturing.
Okay, yeah.
So we don't do a lot of like analyzing. We do more build sprint.
Right.
Stuff, but we do. Most of my years, not a
I didn't use it, but keep going into because I keep going up here. Feel free. We don't know what we're doing. Jump on it. Don't have any- There we go. I'll tell you what, though, I have worked a lot of my cooking. So it's the hard way. That is my final.
Registration site isn't registering.
I guess
it was a setup.
There is a sandbox out there.
Get everything together and let's run a meeting, set everything up.
I mean,
And then if we're somebody in the PA, we can break down the
you know, I mean, we may,
Quick before it's presented by
we don't
so
have.
that's why it's coming out.
I know there's not another project.
Really?
And I think we're all.
So that's different, right?
Yeah, where to go?
Sales.
You want the vocal?
Well, the thing is like, network
That-
communication.
We're communicating.
Hey, it does not. And supply chain, because
Nobody wants to.
I mean, I know that.
Showtime in 1 minute.
We keep going back to the announcements.
At least just as an exercise.
This is what we want right here, right? Welcome announcements.
Project.
And that's what it's all about. But here's the present brand.
At
It's
this
a
point,
full
like,
time
that's
as
the only way.
it'll be escrow,
Got it.
Make it better.
We're there. Process.
Thank you, sir.
That is your.
John Fitzpatrick, are we live on the air? We are on the air. Hello, good evening, everyone. I'm Rich Gargis. Welcome to our PMI monthly event. Have a wonderful event lined up with you, for you. Interesting seating arrangements here today. We have some radioactive tables up front, apparently. Well, I do want to welcome all the new chapter members that are out there. We open with the screen typically. And if your name is up here and you happen to be online, and hi, everybody that's online, happy to have you guys here with us. Enjoy this. We know that spending an hour or two with us here is a choice that you have, and we're happy that you made it. We appreciate it. We know the bar is high for what you expect out of it. So if you're here as one of the new chapter, anybody in the house here, a new chapter member? Anybody in the facility here? We have online, we have about 500 people in the room, by the way. There's a new chapter member. Why did you decide to join?
Well, I was a PMI member in San Francisco and I moved over to chapter here. So
Oh, well, welcome to the Midwest. Stay away from that fog problem they have up there in San Francisco. San Francisco is beautiful. I'm jealous of you. All right, and welcome though. Terrific. That was our newest member that we've met in the last 3 minutes. All righty, let's see what else we have. A volunteer? Oh, he's also a volunteer. So I'll be seeing you on a future mini podcast. I'm looking forward to it. You're welcome. Hey, we have some people that are newly certified as well. Their credentials listed here. So any chapter members in the room here, they're newly certified. And if you're online, you're newly certified, please toss that into the chat there and everybody can help congratulate you. So congratulations to those that have gone through the efforts and been newly certified. That's the sound of 500 people if you're online. You can't see the audience. We don't have that camera set up today, but I'm certain that they'll grow in enthusiasm here. Those with 5+ years celebrating 5-year anniversaries. Anybody on this list? Anybody with any anniversaries? Maybe coming up? Okay. Thank you. Welcome. Congratulations for your longevity award there. A few announcements, of course. Sponsor packages to events like this are available at pmicic.org. Also at pmicic.org. If you are looking for a job or you're looking for employees, you can go ahead and have a job posting there. That's still free, isn't it? For a limited period of time. That's a free job listing. October 27th is the next downtown meetup. That'll be at the garage in Indianapolis from 5 till 7. I believe the appetizers are free.
Yes, they are.
Free stuff. Isn't that wonderful? Okay. The board of directors meets, and to attend their board of director meeting, guess how much it costs? That's 500 people saying free all at the same time. Yes, it's free. Running a theme today, this evening here. Don't lose your chapter benefits. Make certain if you're one of those new people. Where's the new person? Where'd he go?
He's on registration table.
You're busy volunteering over there. Make certain that you sign up to renew automatically your chapter membership. Okay. Otherwise, you'll go without PMBOK for a month and you'll get the shakes. Okay. Thank you. Thanks. I think think he was happy. Okay. And tonight we'll have a survey on how these events is coming along here. We value that. We use it in our retrospectives. So please fill out the survey online, or you'll receive an email version of it. If you're in the room here, please fill out. Take 60 seconds. All righty. And now it's time for a word from the board, I think. I'm checking this out. John, would we happen to have Kelly? Do we have Kelly online? And can we enable Kelly's? So Kelly Sandstrom is to be the board member with a word, but she's online today. So we're making certain that we have her connected. Yeah, congratulations and a woo earlier. I missed that in the chat. I have to pay attention to that. All right, do we have Kelly Sandstrom?
She is. Found her.
Kelly?
Hang on.
Launch Fishers to Kelly. Launch Fishers to Kelly. Introducing
Her microphone.
a word from the board. Seeking Kelly. We await. Who?
I'm here.
Were we awaiting, audience?
Can you all hear me?
You guys really had me worried for a second. I thought I went to suspended animation. Hi, Kelly. It's good to see you.
Hi, can everybody hear me?
You speak really, really loudly. Let me go over and bring the microphone.
Okay, I will take that as a yes. Good evening, everybody. It's very funny because I can see the screen on your screen, so I can see myself. But apologies, I can't be with you all who are in person tonight, but I just want to echo Rich's sentiment and thank you all for spending an hour or so with us this evening. I know you have a lot of ways you can choose to spend your time, and we appreciate that you are here with us, especially for those in the Indianapolis area. It's a beautiful evening, so again, appreciate you all being here. I do, for tonight's remarks, just want to announce a couple of exciting events coming up with our chapter. So in addition to this monthly program that you all know and love, our chapter, believe it or not, is 35 years old this year. So to celebrate, we are throwing an anniversary party. It's coming up in just a few short weeks. It's going to be on a Saturday night, November 4th at 6 p.m. and it will be held downtown. So registration for that is open. It's on our website. We've been promoting that via social media. For our chapter members attending with us tonight, you should have received an email about this earlier today. So registration's open, plenty of information out there for you to learn a little bit more about this event. Did I mention it's free? We are going to have food. We are going to have drinks. We are going to have swag and games. It's going to be an amazing time. I hope to see you all there. And like you see on the screen here, come ready to compete and have a little bit of fun. So hope to see you all at our 35th anniversary party. And if you'd like to bring a guest, you're certainly welcome to do that. The next event I'd like to share with you all is another event coming up in November. Our Social Good Committee, which is our community service arm, bringing you all a chance to get involved out there in the community and make an impact. We have put together a volunteer event for you all on November 18th. It's going to be partnering with Midwest Food Bank in the morning for a couple of hours, packaging up food. So we're looking for at least 10 volunteers who want to come out to Midwest Food Bank that morning and do some food repackaging. So if that sounds like something that is of interest to you, please go out to our website, sign up to volunteer for this event as well. Hope to see you there. All right, I think that's all I've got for tonight. So I will pass it back over to Rich.
As Kelly dims into the western horizon. Thank you, Kelly. Kelly Sandstrom, everybody. Word from the board. Bringing you, among other things, more free stuff. Okay, that's pretty cool. Oh, this slide. You know what this slide means? This slide means that the exciting stuff is just about around the corner here. Okay? So just as a reminder, though, that PMI membership has determined that honesty, responsibility, respect, and fairness are important values that drive ethical conduct. We can practice those as much as we possibly can. Our work presented this evening here is the work of the intellectual property of the presenters, As such, any views, thoughts, and opinions expressed by the same are belong solely to the speaker, like me, and our speaker coming up here in just a second, not necessarily those of PMI or PMI-CIC. And then lastly, unauthorized reproduction or distribution of the copyright work is illegal, punishable in federal law. I'm looking around to see if somebody has their camera and they're videoing me right now. That would be, according to this, marginally not good. Okay, and with that now we get to the exciting stuff. Folks, yeah, Laura Holtz, an MS, PMP, CCRP, is a clinical research associate at the Yale University Center for Clinical Investigations. Laura has a Master's of Science in Communications from Purdue University. And previously, she was Senior Project Manager at the Indiana University Center for Aging Research. Well connected here, got some good Indiana, Purdue, and Yale. Not a bad company to be in there. Laura has coordinated an annual statewide conference focused on palliative and end-of-life communication and research. She's a frequent presenter on regulations, informed consent, decision-making capacity, patient caregiver interviewing, ethics, and research project management at numerous local and national conferences. Laura established and is currently treasurer of the Indianapolis chapter of the Society of Clinical Research Associates, or SOCRA, S-O-C-R-A, and organizes education opportunities to help people become certified clinical research professionals. With such varied experiences, we are thrilled to have Laura in person with us tonight to share her insights. Please welcome me and please join me in welcoming Laura Holtz.
Amount of energy that Rich brings, but I will try and keep you entertained for the next hour. So Rich gave you a little bit about my background. To add to my background, it's really interesting how I got to where I am today, is that my path turned and twisted and waved around until I found what I was passionate about, which was this idea of working with older adults with cognitive impairment in research. But where did I start? I was a high school English teacher. So what I found out is that through my experiences, I didn't recognize that throughout the path of, okay. Do you mind grabbing my slides for me? That would be great. So as I found out, as I started as a research professional, as I kind of moved into this new career, I needed to kind of figure out the path. I didn't go to school for this. I didn't understand it. It was new to me. And so immediately as I started in clinical research, when I started at Brigham Street Institute, they brought me on because of my liberal arts background. They brought me on because of the skills that I brought. I had been a project manager, or I called myself a project manager. I now know that I was absolutely not a project manager. But at the time, I called myself one, right? And then through my experiences, I got this job as a research coordinator. And the first night after I went to the interview, I went home and said, what is a research coordinator? What do they do? And then after my first week of work, I said, what is palliative care? And so I had a really steep learning curve when I took on this role in clinical research. And I had no idea at the time that it would be my life's passion. It was really what I find joy in doing, but I find that I'm excellent and have been able to excel in it because of some of these tools I brought from my previous career. As Rich mentioned, I started because I came to research as a presenter. I was a teacher. I was a speech team person. I was a debater in high school and college. I liked to be up on the stage. I liked to be teaching and educating. So I tried to figure out how I could marry that with the work I was doing. And so one of those things became giving presentations. I started with how to consent people with cognitive impairment, because it's a really hard skill. And I had to learn it because of my job, but then I wanted to help others to learn that. And so one of the talks I ended up doing over the last couple of years has been around leadership. So these are my disclosures. I don't have any disclosures for this presentation. As Rich said, it is all my content that I have put together for tonight. So I walked into Reagan Street Institute a couple of years ago, and one of my colleagues came up. He and I would talk most mornings. I got into the office about 7:30. Our office has a wall of windows. We would watch the parking lot madness as people were jockeying for the one or two open parking spots from the 4th floor. And he kind of turned to me and said, hey, I put your name in for something last week. And I was like, okay, what am I doing now? And he said, by the way, somebody asked if they knew anybody who could talk about leadership and who demonstrated leadership, and I told them your name. And I was floored. I was speechless. I didn't know what to say to that. That he saw me as a leader, because when I looked at my credentials, I never had leader as one of my titles. I was very proud of the fact I was a coordinator, I was a research manager, I was a project manager, but leader was never on my list. And so when he told me, well, we want you to do this talk on leadership, I had to go home and start researching, because even research, that's kind of what we did. I needed to figure out, well, what does that mean, and why did he name me? I had to kind of untwine this really kind of striking puzzle that he had put in front of me. So as I started doing that, I started kind of thinking about what this talk would look like. So I want to ask you around the room, who has, in your professional roles, would you identify yourself as a leader? Great. I'm glad to see so many hands here in the room went up, because I'm going to advocate today, and I'm going to have a call for action today, that everybody on every team has the opportunity for leadership. And I know that this group is so well positioned to help make that happen. As project managers, we have that authority and that responsibility to bring our teams together, to ensure that we elevate the right people at the right time, make sure those levers are going at the right time. But I want to talk about how to infuse some opportunities for leadership. Maybe if the person on your team doesn't have the title or the role, that may look like a leader for you. So that's one of the things I want to do today while we're talking. So I want to talk about what are those attributes of leadership. I want to talk a little bit about the difference between leadership and management, especially because I get them conflated and confused often. And then finally, I want to look about how to go about teaching either yourself or somebody else about how to design their own leadership plan, so that they can then capitalize on those opportunities. They can then learn how to maybe do what I was doing kind of without knowing, to become that leader within their own profession, within their own world. So those are the three things I'd like to do tonight with this group. But as anything, I need to start with the definition. And I looked out there and I read a lot of leadership books, and I started looking at different things on the internet. And I said, well, what definition of a leader that resonates with me, with my work, with the work I was doing at Reagan Street? I'm going to talk a little bit more about what the role is, so that I can define where the leadership and the project management opportunities exist. Mainly because I think that it can be very easily extrapolated to many, many different professions. Project management is such an interesting and unique set of skills that we then apply to so many different industries. So we're going to use this definition tonight. So Brene Brown, she's a researcher out of Houston. She does research on vulnerability and taking chances and taking risks and being vulnerable. And she's a social psychologist, social scientist. That was the type of work I was doing, so it resonated well with me that this is a good definition I can glom onto. She says, I define a leader as anyone who takes responsibilities for finding the potential in people and processes, and who has the courage to develop that potential. And for one lucky person in the room tonight who's involved with the raffle, you may be going home with this book that this quote came from. What I liked about this is I wasn't a really natural leader, manager, trying to get people on my team to follow me. I was a teacher. I was used to being in front of the room and having students do what I asked them to do, because that was the dynamic that we set up as a teacher-student relationship way back when I was teaching. It's different now, and I love the new dynamics in the classroom now, but way back when the teacher would say something, the kids would do it, and it was great for me, because I didn't inherently have those skills about inspiring and motivating teams. I was really good, though, at managing processes. I knew how to take it from step 1 to step 25 and get you all the way there every step of the way, through a technical writing, through demonstrating with standard operating procedures. That was my sweet spot. So I like this because it did emphasize that you can be a people leader or you could be a process leader. And I think project management really demonstrates that as well. At our research sites, we really have, when I'm speaking about research sites, my experiences are in clinical research. So we're trying to develop new therapies, new strategies in medicine, and then go through a very rigorous but very structured research path enterprise. With that, we have to manage every step of those research processes. We have to manage that we get the people enrolled in our trials, so the volunteers who are volunteering, that they have provided consent so that they know what they're agreeing to do in the study. That's all part of our work that we have to manage. But then we started having to say, well, how do we get people into the trials? How do we encourage them to do something that's pretty vulnerable? How do we encourage them to participate in medical research where they may be harmed? They may not have benefit. They may have to go through really painful procedures. How do we motivate? How do we inspire? How do we lead people to the decision to do research when we know that we can't do it without our volunteers? So it's this really complex dynamic that we sit within in the clinical research space. So when I laid out like this, I was like, well, that looks easy. We manage projects and we inspire people. Sounds easy. Let me move the curtain back a little bit more and talk a little bit more about this profession, why the dynamics of leadership were so difficult for me to grasp onto when they said, well, we see you as a leader. So what I started thinking about is, well, there are many different facets of healthcare and healthcare research specifically. So you do have your basic science. You're going to have your things that are happening in your labs. You're trying to find different molecules or different formulas. And those are being done with our sponsors, our Lillies, our Lilly folks in the room. I've talked to a couple of you folks. We know that preclinical work is happening. I sat in the space where I was doing human subjects research. So all of my research, I was including humans into a project where we had a very specific hypothesis. We were testing it with very structured and very pre-planned activities. And then we were coming up with a conclusion that was supported through data. And as I was chatting with folks earlier, many of our hypotheses ended up failing. The whole point of research is to get generalizable knowledge, not to get the right answer. We have to determine if the right answer is actually right first, because we don't know that level of the basic question. So, and then once we go through that, we're then taking things and doing systems implementation. So we'll do a project, we'll figure out that something works, and then we have to actually get it integrated into the pre-existing healthcare system. So I did a 8-year study just prior to COVID about working to decrease hospitalizations for long-stay nursing home residents that could potentially be avoided and be safely treated in the nursing home. So that had nothing to do with a pill or a surgery or a device, but rather how did we make the nursing homes function to keep people in their homes because we know that their health will stay longer, safer longer. That's still part of our research enterprise that we do work in. And then finally, we work on how do we expedite this to public health. And COVID, I said, for all the horrible things that COVID did for our society, one of the things is that it brought clinical research to the forefront. People understand what clinical research is now more than they did before. So I don't have to start with, here's what research is. This graphic, I think, is very telling insofar as all those lines that you see in the first part of this graph, those are all the different projects that we will start that we will need to be working through entire projects before we get to one FDA-approved drug. So you will go through thousands, if not hundreds of thousands of projects to get to one drug through FDA approval to market. Wow. So that's why I was so fascinated when my employer offered to send us to the PMP class, even though my title was not a project manager. I was coordinator, I ran trials. I don't need project management, but yet it's been so valuable to me because look at how many opportunities for projects there are. And every one of those projects has to be different to get to that one approved drug. So this is just to give you a little bit of the landscape of the industry which I work and where I, kind of was enamored with and have been fallen in love with. But what I find so interesting is in the project manager role, when we're thinking about project management in clinical research, the part that I have circled is typically your site project manager. They're your patient-facing or your subject-facing person in these projects. That's where I sat for about 15 years. There's a lot of people on top of me who didn't have the same goals that I had. My goals were to work with the patients, make sure that they felt empowered, make sure they were making informed decisions, make sure they got the treatments that the protocol said that they should get so that we can maintain that they safely participated. And yet I didn't have much authority or autonomy within that role. And that was really frustrating. It was really difficult. And so one of the things that I like to talk about with leadership and team management is that even though we sat in this position, that doesn't mean that we are without those traits. It's not that we're without the key pieces like project management to give us the skills that it gives us. So I had to have the project management knowledge so that I could explain it to my higher up why I was doing what I needed to be doing. So project management professional actually gave me the language that I needed to justify to some of those higher ups why I had to do what I had to do to get the project to work on time. Seems like what we do every day, right? But yet it was interesting when I was in that role, it was something I had to fight for. So this graphic is really interesting. It's out of one of our sponsors, which is our drug companies or whoever makes the therapeutic. When you see that trial manager in the middle, I looked at this graphic and I was like, okay, are any of these superfluous? Are any of these the things that we don't actually do in the clinical research coordinator role? And I only found one box that was a duplicate. Everything on this graphic are different projects that we would have to go through to get one drug or one project, one trial through its 5-year duration or through its 8-year duration. All of our projects, if they're funded by a government agency like Centers for Medicare and Medicaid Services or the National Institutes of Health, we usually have a 5-year funded grant. But that also means that we have, in the first year of our grant, we have to specify how we're going to use that money over the 5 years. It is designated into buckets. You can't move it. You can't ask for more, but you can't leave some on the table if you don't spend it all. They'll gladly take it back. But at the end of the day, we have to proactively figure out how we're going to spend all the money, where all the timelines are going to come for that many different groups. And the one that's on the far side is your study team. And as the project manager, as the coordinator, I was responsible for a team of 28 nurses, 10 coordinators, 8 research assistants, and a handful of data people to run this 8-year grant. Well, I also had to do all the rest of that stuff. So part of what I struggled with is the competing responsibilities, the competing demands on my time when I was trying to manage this very large project with an extremely large team, and everybody had to be doing their own thing to make sure that we got all of it covered and done within that 5-year window. So it started to make sense when I started to research it and see pictures like this going, no wonder I feel like I'm running around like a crazy person, because that's what I'm trying to be responsible for. So I found out that I couldn't be the sole person in that role. And that's where I started to develop my own leadership plan that looked to intentionally making opportunities for other people to be the leader. I can't do all of that. And when I tried to do it, it was crazy. And I failed most of the time. I couldn't do it all. But that's how this job is structured. In addition to that, I told you we have a very constrained 5-year budget. We have a very constrained 5-year timeline. But then we also have to meet our enrollment criteria for the studies for 2 reasons. First, if we don't have enough statistical power, we don't have enough data to answer our scientific question. The second piece is an ethical piece. If we enroll people in our trials and we don't get enough people to answer our statistical question, we have exposed people to risk that is not justifiable, and we have an ethical violation now. So not only do we have this strict timeline, strict budget, but the stakes are incredibly high. We can't not be successful on these projects. These projects can't fall apart. So if you want to put that on, 20, 25, 28-year-olds, that's usually our coordinators are in their late 20s, early 30s. That's who's shouldering. That's the responsibility that we're asking them to shoulder. Okay. All right, have I scared you enough? Because it's not until I sat back and started thinking about it, it's like, oh my God, why would anybody take this job? Why would anybody do this? Frankly, I really enjoy it, I really love it. But I want to talk a little bit more about why I think that this is so manageable in the landscape that we have. The first piece is we do actually have very, very well-defined ethical foundations in research. We have very well-defined ethical foundations in research because we've done some really horrible things in our past in clinical research. Not necessarily maliciously, but they have been some very tragic stories. Things like the Immortal Life of Henrietta Lacks talks about taking samples without permission. We have the study of untreated syphilis in the Negro male. It's a skippy study where we were testing to see what the effects of syphilis were if untreated when we already had a viable treatment that we should have been giving them and curing them. We've done some awful things in our past. So though Sarah here in the room is also a research coordinator, and so she's going, we've heard these stories in our profession every day. We know that we can't let those things continue. So we have very strongly worded ethical statements. In addition to that, it is a highly, highly regulated profession. We have rules that specify what we can and cannot do. And most of those rules say, when you have it written down, you must follow it exactly. So as a project manager, I can't go around and have a workaround for anything. I have to do it per the protocol. If I don't do it per our protocol, I actually have to report it to about 3 different agencies, and they have to decide if, A, do I have to stop the study? Do I get reprimanded if I did it wrong? Or if the FDA gets involved, I might find somebody going to jail, what have you. So it's highly, highly regulated. In addition to that, they have guidance after guidance after guidance on how to actually implement those regulations. And so they actually tell us how to do it as well. That makes me feel a little bit more confident and comfortable in this role because they actually do spell it out. But a lot of our younger professionals don't know that these things exist because our training programs are terrible. We don't want to train our people because training would include putting out money and putting out time. And as I've already told you, we have a really strict timeline. We don't have the resources. But yet when we fail to do that, we then open them up to so many different risks, both to the project and to the person. So part of leadership has been that advocate for education, even if it's frontline. A lot of times I'll be like, come with me, let's go, let's work together, let's work in pairs, structuring the training within the job itself, because that's pretty daunting. So when most people think about the project management plan, right, they think about just straight, you've got the path, what the project is, I spoke with somebody who's in construction, we're going to construct a building, how this is going to go. Research never feels that way to me. It feels like we are constantly shifting around. So one of the experiences that we had during COVID was one of our studies was taking biosamples. So they were taking blood samples from, the study was 112 sites for Alzheimer's disease. It was banking Alzheimer's samples into the medical and molecular genetics lab at IU. I was in charge of that. And during COVID, we found out that all sample collection had stopped. I said, okay, they're still coming to their appointments. Why is this stopping? And they said, it's stopping because we do not have the supplies, we do not have the cryo vials to put the blood in to that once we've taken the samples. So we have nowhere to put the blood, so we are not taking the blood. Okay, how do we get cryo vials? Well, we can't. I don't think that we can't is the answer. So what's the next step? So I'll talk you through how we answered that issue, but that's a real issue in research. Sometimes you think, well, we're good, we got cryo vials, we've got orders for cryo vials, we're fine, we'll be taking the blood samples. Something comes in our path. And yet, when I want to change a cryo vial type, I have to get 3 different levels of approval to do that. So, what I started thinking about when I was approached with this idea of leadership, I started thinking about, well, how do I bring everybody up on my team so that they can take some of that responsibility, we can disseminate some of that responsibility that the coordinator had throughout everybody on the team, also as an opportunity to train them up, because in our industry, we're actually facing about a 5,000% delay in hiring of clinical research professionals. And so we are going to have openings in this industry for about the next 12 to 15 years. I don't have enough people out there. So if I train somebody else, I can't lose them to some other competitor who's going to pay them more. I can't lose them to some other culture that they like better. I need to train them up and keep them. So one of the things that I knew I could do is to empower them. And that comes through some of that research that I did about leadership. So I started thinking about, well, who inspires me? How can I inspire others on the team to remain in place, to want to work with us, even in the face of some of these really hectic work processes, deficiencies, crazy schedules, that sort of thing. I looked at, different quotes to inspire me on those crazy days. This one came up: people who are truly strong lift others up. People who are truly powerful bring others together. So that was one of our mottos. I started putting different quips and different quotes on the tops of our meeting minutes. Something for us to rally around in the face of some of that adversity that we were struggling with on these teams when the workload just seemed too much. So the second thing that I started doing is I started talking really honestly about things with my team. So I used to shoulder everything as the project manager. I used to say, okay, there's a problem, let me go fix it. Let me go to the back room and think about the next plan. And I stopped doing that. I got tired of taking all that home with me and having all of it be on my responsibility. They don't have this job too. Their livelihood was also at stake when we couldn't meet our demands or didn't have cryo valves. So let's share that burden with the team. And we did it in a way that we talked about the strength of our team. And after taking my PMP, I realized that Techman already designed it. So let's go ahead and use the model that we already know. So I talked about the Techman's teaming model. And we specifically talked about the different groups of the different strengths of a team. By talking about and again identifying where our team was at, we were all able to very clearly rally around the struggles that we were going through together. As I said, in research, we're constantly hiring. We are constantly bringing more people onto our teams, or people have left. They go to med school, they'll go to a different job. In academia, we struggle a lot where they go off to industry. We get paid 3 times as much. I can't fault them for that, but it does put me in a very, very precarious position. So on our meeting minutes got to be very extensive. We would have a quote at the top, something inspirational. People on the team would contribute it, and we'd say status of our team, and we would put our Techman group in there. On our meeting minutes, it was a thing that we acknowledged every time, and we said, do we all agree? Are we still here, or have we moved to the next step yet, or have we fallen back? And by talking about it, it gave us all permission to know how hard it is when we're forming a team, and know how hard it is when we're storming and making decisions. The next thing that we did is when we were forming the team, we took time to do activities around that. So we took time to think about what are the competencies for a research professional. And that's the competency chart that's up here. Not only were we talking about the competencies, but we talked about, well, what things actually relate to those competencies? Whose job is it that we're talking about when we talk about those competencies? So one of them is reporting to regulatory agencies. Our regulatory agency is the Institutional Review Board, the IRB. They're responsible for ensuring the safety of the participants in your trials, so they have a big job. But you have to be reporting to them every minute when things are happening. They have to know in real time because they're making decisions about should the trial continue? Is it safe enough to continue? And if it's not safe enough to continue, are we going to stop it right away? Or, and especially around, because these are human subjects, we do have deaths in our study. I was working with an older population. I had many deaths in my study. And so they needed to be evaluated. Was it because of my study? Or was it because I was working with older adults with advanced dementia and making the determination in real time, the safety of our participants? So by taking the competencies and relating it to their specific job roles, I was able to help understand and help to train why the competencies are so important, that we know them because it directly affects what they're doing day to day. Making that connection, verbalizing in our group, helped us to recognize how important those responsibilities are. Something we couldn't forget. We also do things like the Myers-Briggs and the Strengths Finder personality test, but then we also said, well, okay, now we have data. We love data and research. What are we going to do with this data? We have data. Now we need to interpret it and analyze it. And it's through this process of analyzation that we were able to come to terms about, like, maybe we need to send the question or the discussion prior to any meeting so people can formulate their decisions or their brainstorming prior to an in-meeting session. I am terrible about thinking about things on the fly. The physician I worked with, I would say something in a meeting and he would give me this sideways look and I would stand up and be like, that made sense in my head. I swear it made sense to me. By having that opportunity to make some decisions ahead of time, it provided that safe space and it provided this respect to our team so that they didn't have that feeling of like, wait, I think what I said made sense, maybe not, I don't know. So by thinking about our team dynamics was just as important to us as thinking about getting the work done that we had to do. Even though in our day it was another thing that we had to do. It was such an important thing for so many reasons. Next to that, when we were in those storming phases, when our team was past we've got everybody at the table now and everybody's trained to do their job, we would have conflicts. We saw this a lot during COVID when we were working remotely. How do you do an in-person job remotely? How do you stay connected as a team remotely? I know a lot of our teams face burnout. I know that they're still facing burnout. So we started enacting, if we have a storming situation, if we have something that we're unclear about, we did a SMART goal. It's a one-page worksheet that I downloaded off of Google, but yet by filling that out, we've done something active with it, and it attends to the concerns that people had. These are not, I haven't come up with anything new or genius here, but rather was putting the processes in place to answer to some of the concerns. As Rich mentioned, I do have a master's in communication sciences with an emphasis on health literacy from Purdue. And so as a manager, my first time I was managing, I was like, I've got an open door policy for communication. And I thought I was so, advanced and unique. And I ditched that real quick after I started working on my master's because I realized that that's such an awful plan insofar as it puts the burden on the person who is not in a power position. If you're asking your employees to come to you, there's a lot of burdens and barriers that they have to get through to get to you. So I actually flipped it on its head and took the responsibility on myself. So instead of asking people to come to me with issues, as a project manager, I had a plan, I had a schedule. I would reach out to my employees on my team, very big team, some of them I didn't see for a couple weeks. Tell me how your day is going. I never used a yes or no question. I never used are you having a good day? Because that's a really easy, yep, and she's out of here. So instead I tried to engage with them in a communication strategy called Teach Back, which is asking for them to, in their own words, relay information to us. It's the same technique that we use when we're consenting people into trials. We want people to teach us back what they learned while they were making a decision about the trials. We use that now in our team building as well, our team communication. Tell me about what you're feeling about this. Tell me about how you feel when you encounter this issue. Tell me your experiences about this. It's engaging in a way that is putting that power dynamic to the side. It's not asking somebody to come to us. A lot of times with that open door policy, when people would come to me, I'd be like, why didn't you come to me sooner? And they said, well, you always look busy. I don't want to burden you. I didn't want you to think that I didn't know what I was doing. So by taking the ownership, I was able to eliminate a lot of that, and I got things done so much faster, and I was able to attend to it sooner. Performing, giving people the autonomy to do the job their way. Can't say that how important that is enough. Your way is your way, but it's not everybody's way. And we also started thinking about ways do we promote people from within when we have constraints on our budgets. We're essentially government contractors. I can't give promotions. I can't give titles. I can't give monetary, can't give vacation because we're under government contract. But there are other ways that we can acknowledge the team that we have. And oftentimes it's just by saying, thank you. We did a team building activity where each person has superlative for others on our team, acknowledging what they're best at. And that's where we're seeing that, where we're trusting each other, we're empowering others through different ways that we look at our work. Well, that's all great. But I've told you a little bit about how I operationalize it on my team. And it looks really nice now. I mean, granted, you don't see all the failures along the way. But I want to talk through next about how can I impart some of the skills that I learned, some of the things that I learned along my path for you to be able to take with you on your journey. So one of the first things that I had to figure out is, what is my leadership style? Who am I as a leader? And so I use this tool from a colleague and a friend of mine here in Indianapolis, Jeff Ton. He talks about having your personal brand and writing it down and figuring out who you are. Looking at what your strengths and your values are, but then also looking at your passions and your purpose. I had a really hard time figuring this out at first. I didn't know who I wanted to be. It's also an opportunity to invent who you want to be. If you want to be somebody different. Second, thinking about what your vision of your leadership plan is. I knew I didn't want to be the CEO. I knew I did not want to be the person in front. I never wanted to be the doctor leading the trials. I wanted to be the helper person. It's where I fit best. I like processes. I like things being clean, neat lines. But that doesn't mean I couldn't be a leader. It just meant I wasn't a leader in doing what they were doing. I was a leader in something else. So thinking about what your vision is for leadership helps me to create that I don't have to be the path they are on. That's their plan. What's my plan? And another way to think about it, because I like lists, I like standard operating procedures, I like processes, there's a list for developing your leadership plan. Think about defining what a great leader is, taking an assessment, identifying your values, what do you want to accomplish, and then analyzing what you think about it, and then executing it, and going back and seeing, did it work? Kind of like what we do with research. In addition to that, I read a ton. I've had several different books sprinkled in through here, and they're just the tip of the iceberg about what there is out there about leadership. Grab a book, start looking, listen to a podcast, listen to an Audible about different leadership styles, and figure out what that area resonates for you. The current one I'm listening to is called the Happiness Lab. It's talk about leading through happiness. I like that idea. It's much easier to be happy than it is to be mad at my work all the time. Invest in yourself. I felt like I came home looking like that crazy monkey every single day. I had to empower myself that I wasn't going to allow work to do that to me. That was a big, bold step when there was a lot of external factors on me. And again, I was talking to Sarah earlier, and that was a really stressful job when I was managing people. And I've taken a step away. I worked for another institution now, and then grabbing back in, and now I'm consulting for them. So I do feel a little bit like that sometimes. But I allowed myself, because I could put very specific parameters around what I would allow in my life and what I wouldn't. It means I missed out on some opportunities. It meant I said no to some things I probably should have said yes to. But at the end of the day, I have to have some of me for other people. I have children, I have a husband, I have friends, I have family. I need some parts of me for other things besides my work. I had to know who my pit crew was. Now, this slide works much better in this type of audience here in Indianapolis. Did not work so well in Montreal last week because they're like, what's that picture? And I was like, it's the greatest spectacle of racing, don't you know? Apparently, this is not as big of a deal in Canada. But what this slide says is you need to bring around you the people who are going to empower you on your leadership plan. And this is the same for everybody on your team. They all need the people around them for their leadership plan. And to talk and empower and educate, this is a very conscious decision, is part of what we can do for our teams. And part of having your pit crew around you is having naysayers, having people who are going to bring the negative perspective so that you can see it very objectively, like we want to look at with our research. We want to have the data and make a conscious decision with all the information that we can have. I love this. So with research, part of our thing is that we don't know if it's going to work. We know that it's intended, some things are intended that they're going to fail. But a colleague of mine, a mentee, said, well, failure is just your first attempt at learning. And I said, I will steal that. Thank you. That is an excellent phrase. Failure has no judgment. Failure has no value. We put value on failure. We think that there's something wrong with it. And so that's a really hard thing that I have to teach and educate my staff about, that failure is not, it does not have judgment. We need to fail to get to the right answer. It's just our first attempt. Part of what we need to figure out is critically evaluating where you're at. Like I said, I recently took a career left turn. I left the management leadership role that I was in. I was done. I needed something new. And so now I'm working on a team where I'm doing very kind of isolated quality control compliance work, because I knew that I was to a point where I couldn't continue on my path. Did I fail? Maybe, if your plan was to go straight up, but mine wasn't. I was done. I needed something that ensured that my skills and my wisdom were where I wanted it to be. And so they've led me to some great things that I didn't even fathom that I could have. But it was really scary to take the step off the path. And then finally seeking justice, thinking about ways that we can promote our employees who maybe are reporting to you or looking for leadership opportunities. They're looking to rise up that ladder. How do we get them there? Because there is enough spots for everybody. It may not be on your team, but if that's the plan that they want, there is no reason not to promote them into that direction. Bringing them the tools, even out the playing ground, bringing a book to them that they may not know about. There is enough space for everybody. And that's one of the things I've learned through my leadership journey. I'm not competing with the people on my team. They're not going to take my job. There aren't enough jobs out there. We have enough work to do. So we need to seek ways that we can make sure that it's justice for everybody, that everybody gets that leadership opportunity to be successful. And part of that is finding your why. Again, I talked about taking this left turn. It's a little scary talking about it. It's a little vulnerable to talk about the fact that I was kind of on this trajectory and I went, nope. A lot of people question my sanity. I think I question my sanity some days. But I knew that I wasn't fulfilling my why. This is Simon Sinek's book. Simon Sinek's work would start with why. And it really led me more towards value-based decisions in my work. It led me towards making sure that every decision I made was based off of my values and my preferences, and not necessarily based on the career ladder or trajectory or the next project that somebody else had in their kit. Like I said, it's an opportunity for me to say, if it doesn't match that, is it going to make me happy if I'm going to take that job? It may lead me to something that I need to have that step. Project management professional was something I needed to have to be successful in my career. But some things that are preference specific, and if it's not meeting your preferences, it may not be right for you. And that's something we don't often talk about in business. And then finally figuring out, my why is my research participants. My why is finding, the day that we were submitting our grant for Alzheimer's disease was the day I got the phone call my grandmother had passed away from Alzheimer's disease. It was that day. I sat there and cried at my desk while we were putting the finishing touches on the grant that was going off to the NIA. And my physician that I worked with said, "Are you okay?" And I was like, what else could I be doing today but doing this? That was my why. It was for my grandma. My grandfather was in a clinical trial back in the 90s for colon cancer. I was 12. I did not understand that would lead me to where I am today. But family is one of my whys. That's why I do this. But if I hadn't known that, it wouldn't make some of those days where we are in the clinic, when I am, have a week where many of my patients are going to pass away because they are older or they are very sick. Those are hard days for anybody. But it helps me to remember my why. And finally, I'd like to say thank you for this opportunity. I've shared with Rich before I started that I spoke with this group a couple of years ago, and I was so naive in bringing this novel idea of the PMP process groups to you all. Prior to me taking the exam, prior to me understanding how fundamental that concept was. But I appreciate the opportunity to come back and talk to you about my experiences, because I have found really exciting things through leadership, through promoting others, that I didn't know was a part of my plan, that I really felt value in. And with that, I'll turn off my mic. That's me. Thank you.
Ladies and gentlemen. Let's turn that down, Jim. I'm sorry, my lightsaber is getting away from me. Where's Obi-Wan? Thank you, John. Laura Holtz, everyone. Laura, do you have time for questions? Thank you again. Let me hang in for a second. We'll take a couple of questions before we can move on to some of the programming type stuff. Questions from the audience? Questions from the audience? Yeah, let me hand you this microphone, but be careful. It can get away from you.
Yeah, I'll get my Jedi skills out. Do you think your diverse background really contributed to your ability to lead? And do you think it's a barrier for people who have a mono background that really don't have that range of experiences to pull from?
Thank you. I appreciate that question. I do think that leadership is something that anybody can do. If you are not comfortable up on a stage, which I know many people are not, I taught the speech class in high school. I had teenagers telling me that they were going to die if they had to give a speech. So I get that not everybody's comfortable up here, but I think things like mentorship, finding somebody who's new to the profession and saying, here, let's meet for lunch, working one-on-one with people. I think those are all demonstration of leadership, because you're promoting the potential in others. You're helping somebody else recognize what's important to them through expertise, through your skills, through camaraderie and friendship and trust and respect. So I don't think it's a one size fits all. I think leadership can be how you're most comfortable. I think it's just really taking that call to action and being purposeful and intentional and being a leader to somebody.
Thanks for the question. Great. Laura, I want to let you know, we had you closed here with, it's just prior to the slide, the participant, the trial participant was why. And we have someone that was online early on and during your presentation here noted that he was a patient at 5 weeks old, whooping cough, 1951. And he's run marathons and played 30 years of soccer against Pele's teammates and stuff. So just wanted to point that out. That's in the chat. You probably can see it.
That gives me chills. It gives me chills. Whooping cough in the 50s could have been deadly, and now we have cures for that. And we have treatments for that because that person was so generous with themselves.
Yeah.
So I thank you.
Absolutely. Any other questions from the audience in here? Yes, ma'am. Let me read this to you.
So as you started taking your steps towards leadership, did you ever kind of face any imposter syndrome? I saw that chart there where you kind of have Mount Stupid, I think is what it said, and then you have this like downhill slide, and so your confidence kind of wavers. What did you do to combat the imposter syndrome?
So I experienced imposter syndrome last week. I was at the national conference for SOCRA in Montreal, and I just stepped into the president-elect position, which to me is like not part of my plan. It was not something I ever expected to do, but I'm really excited that I did. But I had a moment of like, oh, I am the wrong person. Like the person who is the current president, she's incredibly eloquent. She was moderating things wonderfully. She was very articulate. I'm like, I can't do that. I can't do that. I have to do that next year. I can't do that. But in that moment, I had to say, okay, time out. Let's be vulnerable with ourselves. Let's ask ourselves, can you do that? Not the same way she did it. I can't do it the way she did it because I'm not her. So I'm going to have to rely on the fact that I genuinely love SOCRA. I've been part of that organization since 2010. I've been on the board for several years. I had to remind myself that I'm not going to do it perfect, and I'm going to fail, and that's okay. And yeah, it sucks. But at the end of the day, I think that if you have that team behind you, if you have people that trust you, they want what's best for you, just like you want what's best for somebody else. So it's that genuine giving of yourself to the organization, to the group, to the team, to the project. I think that being genuine, being authentic is what kind of I can counteract it with. But absolutely, I still go through it. I think everybody does.
Thank you much. Good for questions in the audience here. Looks like it. Laura, thank you very much once again. You've been fantastic. Laura, hang around here for a second too, because I have a colleague here that's ready to present you with some modest symbols of appreciation. Maybe we can get one to show on the screen. Not too close, Laura. We'll have to maybe bring this down a little bit. We turned it up so the people online can hear. The microphone for the people online is with the camera. All righty, congratulations. Thank you. There's the mug on the screen behind you. Yeah. You're welcome, Laura Holmes. Laura, will you come back and play Would You Rather with us in a few minutes?
Yeah.
Oh, excellent, thank you. It's so much more fun when there's somebody else up here doing that with me. And now, John, I think we have a video to play at this section of the meeting time as we segue into the Would You Rather networking activity. And we're bringing Adrian Roman online very shortly with, I think, maybe this upcoming video. Hi, everyone. Welcome to the mini podcast. We have another volunteer this month for you. I'd like to introduce everybody to Adrian Roman, our PMI Volunteer of the Month and special guest of the Volunteer Mini Podcast. Adrian, how are you doing today?
I'm doing very well, thank you.
Good. I'm glad. The questions do get tougher from here, Adrian. Okay, so that we tossed you a softball to start with there. Adrian, you do volunteer work for PMI. Tell us a little bit about that.
So I've joined the membership committee. I got my PMP certification last year and attended the informational orientational session and thought volunteering would be a really great way to get to know more people in the organization, and kind of got cued into the membership because that's something I really enjoy, is meeting new people and kind of getting more people into our organization, and just because I think there's so many valuable resources here. And so I do a lot of just kind of emailing. So you'll probably see if you have an anniversary with PMI coming up, or if, there's sometimes I'll help with like new certifications, things like that. Those are a lot of what I help out with on the team, is just kind of helping acknowledge everyone's engagement with the.
So you work at recruiting membership for overall members or for volunteer members?
For overall membership into the PMI organization.
Okay, so how's
and
that
right
been
now,
going?
also training people and making sure they still maintain membership of the PMI organization as well.
Wow, sounds like you keep busy on this. When you're not volunteering for PMI, what do you do?
So I'm a program manager for a biotech company called Lumina that's out of California. So I work remotely. So a lot of time on the computer. So actually, helping out with things like emails and stuff is right up my alley. It's what I do a lot during my day. So.
Well, thank you very much for the volunteer work you do in PMI locally here and for hanging around with the rest of us. What is it that you enjoy most about the volunteer experience?
I really like the people that we work with. Everyone that's part of this local chapter is incredibly friendly and supportive. They're easy to work with and talk to, and I've really just enjoyed getting to know everybody involved.
Very nice. Well, thank you so much again. And is there any final word you want to leave members since you're like membership chair?
Well, thank you for, well, not the chair. Yeah, I am just a lowly assistant, but I just appreciate everybody that has joined and has continued their membership. And just, please spread the word and bring your friends and encourage them to join, because there's just so many good resources, including, the monthly events, but also online. There's a lot of great resources to help and better your work.
Everyone, join me in thanking Adrian Roman. Bravo. Thank you. They're cheering you right now, Adrian. Thank you so much, ma'am. Thank you much. Adrian was wonderful. Couldn't be here tonight. We did that recording there. I don't really know how to do podcasts, but I can shop Amazon for large microphones. You may have noticed that. That's part of it. Yes.
Could you,
Yes, Caitlin.
could you just give me a couple of minutes? If I could have all the volunteers please stand up, just so that you guys understand who they are and the fact that we cannot put on these type of programs without our lovely volunteers. So thank you, volunteers. Appreciate your time.
Thank you much. Hey, come on back. And have a seat here. It's time, guys, for Would You Rather. We'll have these online for those in the room. The Would You Rather questions will come up on the screens. You'll be able to see them. And we'll vote in here the old-fashioned way with a showing of hands for one alternative or the other. In the meantime, if you're online, you'll be able to participate in the surveys. And I have the questions here to prepare for them. John, are you ready? Can you bring up the first one here? And if we're matching numbers, I hope we're matching numbers here. Is this the remote team one? Yes. Would you rather work on a remote team or in a traditional office? Remote team, we'll check in with Laura here in a second. Remote team, we're gonna have people think about that. Would you want to go first? Go first on this one, Laura.
I'm gonna knock the microphone because the microphones are good. I'll just talk loud. Is that gonna work?
I'm getting head nodding. Go for it.
Okay. So I had worked in a traditional office. I enjoyed it. I like seeing all the people, but I work remote now and I love it. My team is completely remote. We are going to meet for the first time at Yale next week. After 2 years of working remotely for the organization, I like the opportunity to do my workouts midday. I like the opportunity to kind of flex my hours to accommodate for my family. And since I'm doing mostly electronic work, I'm doing work with medical records and patient records, I really don't need to sit in an office to do that. I can do it at home. So.
All right, resounding. Okay, in the room. Let's see. I match up people in the room first, then we'll go online. John, I think you can pick that up online. Let's double check that. Okay, in the room, remote. Who would say I love the remote experience? Hands up. I'm proud. Okay, that's like 60%. Let's see what the other part looks like. 40%, and everybody else. Wow. Okay, that's fairly evenly split. That's there. There are all sorts of things I can do remote, but there's some new teamwork that I'm doing. It really needs to be in person. But if I have to pick one, I'm thinking remote. Much more versatile that way. Did we get, let's see. It's 55% we're voting. Scroll down to see the responses, John, on that view. So we see the answers underneath, I think underneath this. Can you scroll that view? I have the banner in front of me. Look over here. That one's closer. Can you dial that down, John? Use that little slide bar that's next to yeah.
It's as far down as it's gonna go on this screen.
Okay. Okay, so we're not sure. We'll try to hang on. We're getting some technical assistance there. We'll see if we can.
Remote team was 39%.
55% means the number of online people participating.
Remote team was 39%. On-site in office was 23%.
Okay, 39 and 23. All righty, maybe that adds up to 55. That's it. All righty, good. Okay, good. Thank you with that. Let's go. We'll move on. Let's go to the second one there, John. This is, would you rather come in early or leave late? Would you rather come in early or leave late? I'm going to leave with the audience this time, though. Okay, and there it is. Would you? Oh, that one's coming up, but not quite yet. Yeah, that's is that number 2? Let's do this one. It's more fun. Would you rather have Barney as project manager or Big Bird? We'll do the one that's up there at the studio audience at home. Okay. No, we said we were going to go them first. Okay. Big Bird. Who chooses Big Bird? Big Bird is wow, doing pretty well, 80% maybe. And Barney. Barney is project manager. Okay, it was a lot more than 80%. It's like all people voting. Okay. Laura, what would you have chosen?
Oh, I'd get an absolute Big Bird. Started every day with the Sesame Street. So.
Big Bird, project manager. It's a big bird as well. Let's see. What's the next one online, John? If you can find one there. Oh, there we go. We got results on this one, and definitely Big Bird. And there were some votes for Barney, so Barney's not to be left out. There's a Barney fan or two that are out there. All righty, you bring up the next one, John. We'll go by what you can transmit here. Anything after number 2. And tell me if you're doing okay with that, John.
Yeah.
Or I'll just pick one.
Uh,
But one that the audience can see is always more fun.
15-1, 14-1, 13-1. You have a preference?
Nope. No. At this point, we'll work with it. Would you rather be? This is an interesting question. It was geared to be the last question, but we'll have fun with it now. Would you rather be the absolute best at something that no one takes seriously, or average at something well respected? The best at something people don't care about, or average at something that people appreciate? You want to go first or the audience? I'll give you either audience. Let's go to the audience then. Okay, who would like to be the best at something that doesn't matter? We have about good 60, maybe 70%, maybe more. And who'd like to be average at something that's really appreciated? We have a strong contingent on one side of the room, actually, and one person on the other side of the room on that, but probably around 15-20%. 65% people voting online. Let's take a look at these. And it looks like average is leading the online folks. Average is something that's well respected. Almost a 2-to-1 margin there. Laura, what would you have chosen this? What did you choose in this one?
Yeah, I would want to be the absolute best at something that no one else cares about. Because it makes me happy, right? Like we just talked about, like I want to do something that makes me super happy because it's my life. So I'm going to do the thing that I want to do, even if no one else really cares about it.
All right, excellent explanation to that too. The logic, that's very good. What's that?
Like risk management.
Like risk management. Ooh, risk management. So we get a nice PMI twist to the question. Hey, John, you're driving now. Go ahead and pick it up. Just realize the questions I have are not in the order that I put them in the survey when we did that. What number? Wild man.
Let's go. Just on down the list.
Here we go. 14. Second from last. This is. Would you rather work on a team that prioritizes efficiency or creativity? Would you rather be working with a team that had greater efficiency or greater creativity? Laura? Go ahead.
The project management me says efficiency is the right answer, but hands down creativity. I think it's just so much more fun to work on a creative team with new ideas.
Creativity for Laura here. Let's say do we have results? Yes, let's go online this time, and then we'll come back to the room here. Yeah, slide that down there. Almost 50-50, I think, between with efficiency, having the edge with the online people. Let's check with the people in the room, though. I think they're real experts. Efficiency. Those that say, I'm a team with great efficiency. All righty. I want to say 50% with that, but let's see the other hands and see if it's about the same. Creativity, guys. Creativity, I would put the edge. I put 65-35 in the room by estimate there. Okay, great. Next one, John. We're in your hands, man. Your pace. You call it. Got some other winners in here, I think. All righty. Would you rather work in a client-facing role or behind the? I'm not going to ask you this anymore. Like, I think we got this one. All right. Okay, but let's check in with the audience. Who would like to be in a client-facing role? Okay. It kind of grew over time, 15, 20, 25% maybe. And who'd like to roll in the background there? I think I had it right. It's about 75-25, roughly in there. Would you say? Okay. And that's it. The online people, the online folks, what are they? Are they like the room? 65% participating, which is good. Client facing. That's okay. I like the irony there. It's client facing 2-to-1 with online people. That are there sitting with their clients enjoying a drink, perhaps. John, we're back to you again. You're doing a wonderful job there. Yeah, I was in the background with you, right? In the background, I guess, right? Yes. Client facing, definitely client facing. Alrighty, would you rather work at home in your pajamas or in the office in a suit? Oh, Laura makes the question a lot better, doesn't she? Yeah, let me do it. Let me just say it because would you rather work at home in the suit or in the office in your pajamas? Let's answer that one. That was more fun. Thanks to Laura here. Okay, and which is it?
Oh,
pajamas at work. Pajamas at work. Oh, okay. Yeah, I'll work at home in the suit. Thank you. We're a little different in this room. Okay, audience in here, studio audience. Pajamas at work? Who are pajamas at work people? You're all kind of a little weird. and at home in a suit. Okay, see, I do have. Yeah, that's about 60-40, 55-45. Online people, 70%. We seem to be getting more people participating. It tells you what they're doing now. I see you in your pajamas. Right now, you are in your pajamas. Just saying, this camera works the other way too. It's new technology. We just want to be on. We can see in your home. John, take me away. Give me another one, please. Do a little time check here. We're doing great. You having fun with this? This is cool. Yeah, appreciate your willingness to share. All righty. This is about pajamas, suits, work. What could it be? It could be anything. Would you rather have a project sponsor? Ooh, serious one. Would you rather have a project sponsor that gets in the weeds and is in the way, or a project sponsor that is aloof and absent? I'm going to go to the studio audience in here first on that one. What Laura's thinking hard about this one here. Do you want someone that's kind of in the weeds and in the way? Who wants in the weeds and in the way? Minority here view, it looks like 15%, 20%. Who would like someone who's aloof and absent? Just think, pretty nice majority here, 80%, 85% or something. Do we have the online 63% voting? And they are aloof and absent. Laura, what do you think? Where are you?
So in this new compliance rule, I actually probably have a different answer than I was a couple of years ago, insofar as our regulations require that our project managers, our principal investigators, our sponsors have to have an active role. And so when they don't, I can't get anything done. They have to make the decisions. They have to be the people who are accountable. So before I would have been like, oh, get them out of the way. Let me do my job. Now I'm like, I really need them at the table. I really need them participating because I just can't do anything without them. So it's interesting that now
you're forced into this. If you had a choice.
I do want everybody to be at the table and to be part of the decision. So I actually, even if they're there, they might bring an idea that I didn't think about as a project manager. So I would rather everybody feel empowered to have a voice than not to be there at all.
Very good. Thank you. Yeah. Good explanation. You're structurally, we're kind of forced into one of the answers though.
Yes.
All right. John, got another one coming up? Got time for maybe, we got time for a couple more. Yeah. And let's see which one he spins. He's rolling the dice. This is like Dungeons and Dragons. We have no idea what we're going to get into next. Okay, would you rather prioritize results or company culture? Results versus culture in terms of what you prioritize. Let's go in the room. Who'd go with what's the first one up there? Yeah, results. Who's results? I want to be results oriented. About 50%, I think. How about culture? Who believes culture? And the culture people put their hands up real quick. Did you notice that? I'm going to give them the edge, actually. I think it's 55-45. Culture people. Online, what are we looking at here? Results at 42 to 16% there, about 2 to 1 margin. Put the online people. We have results people in their pajamas that are sitting next to their facing client face people. Laura, how about you? Results or culture? Yeah.
I was letting you continue to meander and talk about it because I can't come up with an answer. In research, I want results. I want to have an answer to our questions. So I really want results. But I really want to have fun and enjoy where I'm working. So I can't figure out where I land.
And I meandered for as long as I could.
I know.
You could wait till next month's presentation. We can invite you back, perhaps.
I will go with culture because I think a good culture will drive results.
Laura takes a stance on culture, and you can get there eventually. Okay. I think it makes sense. Is that where some of you came from? That perspective there? Yep. Yeah. Culture is the path.
What do you prioritize? If you prioritize results, you're going to beat people to death, and then they won't get results.
We have a comment coming in. What would you prioritize? And culture is better to prioritize, or you can beat people to death just going after results first without paying attention. I can't. That's a very good point. Very sound. In the meantime, I've been meandering while John brings up the next question. Or am I getting some hand signals that I don't know what they mean? It looks like the stock dropped here. Yeah, we'll do that stock price thing. Hey, how's this going? Is the stock price of the meeting rising or falling? Or would you rather be the manager whose job it is to delegate, or the worker who gets to do the actual work? A manager that delegates, worker that gets stuff done. Who would like to be the manager that delegates in the room? Yeah, a lot of them put their hands up fast too. Who'd like to be the worker that gets stuff done? Less so, but God bless you people for getting stuff done. Truly. Online, what do we think? That's it. 63% participating, and I'm sure there's some results to be had. Manager that delegates, okay? And worker that we need more workers that get stuff done. But Laura, where do you fall on this one? Delegates get stuff done.
I think I mentioned I took a hard left.
Yes, you did. I remember that.
And I did that because I was so far away from the work. I was so far away from the patients. I was so far away from the research that I loved. So I actually am the person who wants to get the stuff done. I moved away from the delegating, and I'm much more in the camp to do the work.
We have another one in the camp of get stuff done. Again, thank you for getting stuff done. I appreciate that. Tough one for me. Probably I like the stuff done myself on this one. John, let's do, I think we can get 2 more. I think I got enough for that too. Would your project team rather have a fully stocked snack bar or a limitless? I'm glad we're getting to the serious questions now. Fully stocked snack bar or a limitless coffee machine? Yes, we're getting yes, you can't do that. Would you rather? It defeats the whole purpose of the game. Okay, folks, snack bar, fully, yeah, snack bar, okay, a lot of snack bar, okay, and unlimited coffee. Well, okay, that's not bad either. Wait, several of you put your hands up both times. That's almost not fair. I'd say 2/3, 1/3, maybe 2 to 1. And online, 80% of a popular question. With 80% voting, the results for online people. Right now, they're at their fully stocked snack bar. Words are getting more difficult as the evening goes on. Is that with you too?
No, I'm a coffee person. We have his and hers coffee pots at home now, so I get a full pot of coffee myself every day.
Wow.
I think it's so in coffee pot you don't share.
curious, how deep in the day do you go leaded?
I used to have a hard cutoff at noon, but now I'm kind of like a 4 or 5 o'clock person.
4 or 5 o'clock? You can go leaded till 4 or 5 o'clock?
Yeah, but I work at home, so it might.
In your pajamas, yes, we know. Okay, that's good. Before we overshare, let's go on to the last question that we're going to do. John, one more, then we're going to call it a game like this. That would have been a lot of fun. Okay, here we go. Drum roll. I hope it's a good one. Well, it's not a bad one. Would you rather have would you rather have a day off or a day alone at the office? Would you rather have a day off or a day alone at the office? Oh, I'm going to wait. I'll give you time to think about this one. Okay, folks in the room here, day off. Would like the day off? All right. Who are the weird ones that would like a day alone in the office? Yeah, I know. I'm putting my hand up slowly right now too because I'm in it. I'm wondering. How about online people? All righty. Yeah. So we close with one with not a lot of ambiguity on this one, but let's see what Laura says and see if she's with the three of us, by the way.
I'm with the group who's taking a day off. Are we going on a hike? What are we doing on our day off? I know I'm not.
You're not getting work done.
That's okay.
Well, the no results are coming about.
There will be more work tomorrow.
Your client-facing people are going to be. I'm not going to win the sentence.
We have felt redundancies in our program, so there's somebody there when I'm not. Right? That's what we were taught to do, right?
Yes, well, I think you help teach us. Everyone, help me thank Laura Holtz yet again for this. Thank you, everyone. And it's time now for the raffle. So Laura is selecting something out of a cup. And I think you'll like to read a number.
Would like me to read the number?
885.
2329885. 885.
885. Is it? Let me check. Is it possible someone online?
So
No.
we have our remote people too, but they drop off early and they don't raise their hand quick enough.
So it could be. Okay. Could be that someone did stick around for the raffle.
2329897.
9897.
He is online. It's Ken Rowe.
Ken Rowe, the man, the myth, the winner in this case. Congratulations, Ken. I'll hand this to you through the camera because we can see inside your house and I see the nice pajamas. There you go. All righty, one more. What's this item? What's the item we're vying for? Dare to lead. That's great.
2329861.
We have a winner in the room. 9861 is a winner of the official PMI coffee mug. Congratulations. Thank you very much. Thank you, audience, for being here. Audience that are online, thanks for sticking around. Thanks for playing Would You Rather. I hope you had some good time doing that. Laura Holtz, it's been an absolute pleasure. You'll always be known as the fantastic Laura Holtz. Thanks, everyone. That's an evening. Be safe. We'll see you. Hang on. Caitlin, do you have anything else to talk about? Just stick around for a picture. And that's it. Thanks, everyone. Good night.